Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
Which of the following symptoms is common in clients with active tuberculosis? 1. Weight loss. 2. Increased appetite. 3. Dyspnea on exertion. 4. Mental status changes. The correct answer is 1. Tuberculosis typically produces anorexia and weight loss. Other signs and symptoms may include fatigue, low-grade fever, and night sweats. Increased appetite is not a symptom of tuberculosis. Dyspnea on exertion and change in mental status are not common symptoms of tuberculosis. A client is receiving streptomycin in the treatment regimen of tuberculosis. The nurse should assess for 1. Decreased serum creatinine. 2. Difficulty swallowing. 3. Hearing loss. 4. IV infiltration. The correct answer is 3. Streptomycin can cause toxicity to the 8th cranial nerve, which is responsible for hearing, balance, and body position sense. Nephrotoxicity is a side effect that would be indicated with an increase in creatinine. Streptomycin is given via intramuscular injection. The nurse is reconciling prescriptions for a client diagnosed recently with pulmonary tuberculosis who is being admitted to the hospital for a total hip replacement. The medication prescription sheet says isoniazid 300 mg PO daily, rifampin 600 mg PO daily, pyridoxine 10 mg PO daily, ethambutol 400 mg PO daily, and pyrazinamide 1.5 grams PO daily. The client asks if it is necessary to take all of these medications while in the hospital. The nurse should 1. Request that the healthcare provider review the prescriptions for a duplication between isoniazid and ethambutol. 2. Inform the client that all drugs will be discontinued until the client can eat solid foods. 3. Ask the pharmacist to check for drug interactions between the rifampin and isoniazid. 4. Tell the client that it is important to continue to take the medications because the combination of drugs prevents bacterial resistance. The correct answer is 4. The nurse should tell the client that it is necessary to take all of these medications because combination drug therapy prevents bacterial resistance. They will be administered throughout the hospitalization to maintain blood levels. The healthcare provider will review the prescriptions per hospital policy because the client is being admitted to hospital. There is no duplication between any of the drugs being prescribed for this client. It is not necessary to ask the pharmacist to check for drug interactions, as these drugs are commonly used together. What is the rationale that supports multi-drug treatment for clients with tuberculosis? 1. Multiple drugs potentiate the drug's actions. 2. Multiple drugs reduce undesirable drug adverse effects. 3. Multiple drugs allow reduced drug dosages to be given. 4. Multiple drugs reduce development of resistant strains of the bacteria. The correct answer is 4. Use of a combination of anti-tuberculosis drugs slows the rate at which organisms develop drug resistance. Combination therapy also appears to be more effective than single drug therapy. Many drugs potentiate or inhibit the actions of other drugs. However, this is not the rationale for using multiple drugs to treat tuberculosis. Treatment with multiple drugs does not reduce adverse effects and may expose the client to more adverse effects. Combination therapy may allow some medications to be given in reduced dosages. However, reduced dosages are not prescribed for antibiotics and anti-tuberculosis drugs. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative, 2. Needing to be repeated, 3. Positive, 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm, raised area, or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. A client had a MAN-2 test result of an 8 millimeters in duration. The test is considered positive when the client 1. Lives in a long-term care facility. 2. Has no known risk factors. 3. Is immunocompromised. 4. Works as a healthcare provider in a hospital. The correct answer is 3. An induration of more than 5 to 15 millimeters to 10 MAN-2 units is considered a positive result, indicating TB infection. An induration of greater than 5 millimeters is found in HIV-positive individuals, those with recent contacts with persons with TB, persons with nodular or fibrotic changes on chest X-ray consistent with old healed TB, or clients with organ transplants or immunosuppressed. An induration of greater than 10 millimeters is positive, and the client may be a recent arrival from high-prevalent countries, resident or an employee of high-risk congregate settings, or mycobacteriology lab personnel. Persons with clinical conditions that place them at high risk, a child less than 4 years of age, or a child or adolescents exposed to adults in high-risk categories. The nurse is teaching a client who has been diagnosed with tuberculosis how to avoid spreading the disease to family members. Which statement indicate that the client has understood the nurse's instructions? Select all that apply. 1. I will need to dispose of my old clothing when I return home. 2. I should always cover my mouth and nose when sneezing. 3. It is important that I isolate myself from family when possible. 4. I should use paper tissues to cough in and dispose of them promptly. 5. I can use regular plates and utensils whenever I eat. The correct answers are 2, 4, 5. When teaching the client how to avoid the transmission of tubercle bacilli, it is important for the client to understand that the organism is transmitted by droplet infection. Therefore, covering the mouth and nose when sneezing, using paper tissues to cough in with prompt disposal, and using regular plates and utensils indicate that the client has understood the nurse's instructions about preventing the spread of airborne droplets. It is not essential to discard clothing, nor does the client need to be isolated from family members. A client with tuberculosis is taking isoniazid, INH, to help prevent development of peripheral neuropathies. The nurse should instruct the client to 1. Adhere to a low cholesterol diet. 2. Supplement the diet with pyridoxine. 3. Get extra rest. 4. Avoid excessive sun exposure. The correct answer is 2. INH competes for the available vitamin B6 in the body and leaves the client at risk for development of neuropathies related to vitamin deficiency. Supplemental vitamin B6 is routinely prescribed. Following a low cholesterol diet, getting extra rest, and avoiding excessive sun exposure will not prevent the development of peripheral neuropathies. Clients who have had active tuberculosis are at risk for recurrence. Which of the following conditions increases that risk? 1. Cool and damp weather. 2. Active exercise and exertion. 3. Physical and emotional stress. 4. Rest and inactivity. The correct answer is 3. Tuberculosis can be controlled but never completely eradicated from the body. Periods of intense physical or emotional stress increase the likelihood of recurrence. Clients should be taught to recognize the signs and symptoms of a potential recurrence. Weather and activity levels are not related to recurrences of tuberculosis. A client who has been diagnosed with tuberculosis has been placed on drug therapy. The medication regimen includes rifampin. Which of the following instructions should the nurse include in the client's teaching plan related to the potential adverse effects of rifampin? Select all that apply. 1. Having eye examinations every 6 months. 2. Maintaining follow-up monitoring of liver enzymes. 3. Decreasing protein intake in the diet. 4. Avoiding alcohol intake. 5. The urine may have an orange color. The correct answers are 2, 4, and 5. A potential adverse effect of rifampin is hepatotoxicity. Clients should be instructed to avoid alcohol intake while taking rifampin and keep follow-up appointments for periodic monitoring of liver enzyme levels to detect liver toxicity. Rifampin causes the urine to turn an orange color, and the client should understand that this is normal. It is not necessary to restrict protein intake in the diet or have the eyes examined due to rifampin therapy.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.